The world over is talking about it, so let's add our 2 cents to the conversation. The world over is talking about it, so let's add our 2 cents to the conversation. Young people of Zimbabwe, let's discuss. Because the decisions taken do affect us. They affect us as young people, they affect our future, and they're affecting everyone else in the nation. So I would love to hear what is going through your minds during this time, besides just posting hot selfies on Instagram. What's the topic? Schools reopening amid the Covid-19 pandemic. And why talk about it? Because like I said, the decision of opening schools affects us. It's our education being affected, with some of us even having to repeat the school year. So why not also be a part of the conversation? Here to engage with you is your host for today, Rufa Rosebud, with a PH and an E, representing the Live Talks series by Light of Hope. Why the Live Talk series? Just to stimulate the conversation a little, get young people involved in today's conversations. So catch you on the flip side of this video when we look at the facts and get into it. Let's meet the sponsors of today's video, and I am happy to say that these are 2 handsome and amazing young gentlemen with a strong work ethic who are in their early 20s but managed to start a flourishing business supplying roadrunners, the traditional chickens, and broilers, the chickens that went to private school that you get in restaurants, fast food chains, and they even supply to schools too. Premier House Chickens is the name of their business, where quality chickens are served quickly, right at your doorstep too. So talk about convenience, anyone? Right. So if you want to order yours and support some of the leaders of the future, do feel free to get in touch with them. This is a pretty serious topic, and we're going to try bring across the facts and articulate them as clearly as possible without offending anyone. But I just want to get us engaged as young people. So first of all, I want to applaud the people in authority who had to make the call of reclosing schools, especially since some of us had only been to school for a week. I know that a lot of people got so angry and frustrated, and many are worried, myself included, about how it will affect the flow of the school year. The syllabus still needs to be covered and finished, exams still need to be written, but let us remember that a life is always more valuable than repeating the school. I know things in Zim are hard, I know. A simple loaf of bread is going for $65+. There's hyperinflation, an economic crisis, and the health sector is in crumbles. So just having to think about sourcing more money for a school year to be repeated when most of Zimbabweans are living and just surviving hand to mouth is a lot to take in. But let us try and put into perspective why the decision to close schools was the right one. And we would love to hear your thoughts, especially from young people. So leave us a comment in the comment section down below. Don't forget to also leave a big fat like if you like this video, and subscribe to the channel if you want to see more content like this that stimulates your mind as young people and you want to be a part of the Light of Hope journey. And for notifications as soon as a new video is posted up, please do click the little bell button next to the subscribe. A few days ago, a letter was published that lets us know that the few doctors who were left working were withdrawing their services because their salaries were hardly enough to cover the basic needs for them and their family. There were no medical supplies in the hospitals. We are talking no PPE, no N95 masks, no protective wear, and no nurses. So people are dying. Our medical hospitals are death zones with babies dying, adults dying, and no nurses to help with the procedures. And all medical health professionals are depressed instead of feeling something good about going to work and saving lives. This is more than having a dilapidated health sector, and in a worldwide pandemic where there is no cure for the virus, the main hospitals in the largest cities, Harare and Bulawayo, are reporting that the beds able to handle COVID-19 patients are at full capacity, meaning that there is no more ability in the hospitals to cater for more COVID-19 patients coming from the outside. So people are actually having to be sent back home. And with no beds, no ventilators, and no medications, and clearly no staff to combat this war that we find ourselves in. It would be just ridiculous to let the number of cases skyrocket. So in such a situation, opening schools will actually skyrocket the number of cases past the 3,072 plus cases that we have, and it would increase deaths. How, do you ask? Number one, our schools from primary to tertiary institutions do not have the ability to track cases. Simply checking temperature at the door and sanitizing is still not enough, because not everyone who has COVID-19 has symptoms or will have a fever, and some people will be asymptomatic, meaning that they will not be presenting symptoms and they're walking around spreading the virus. There are those that could be pre-symptomatic, meaning that the symptoms have not yet set in, and they will be still walking around spreading the virus. Number two, a child exposed while at school will come back home and spread the virus to their family, which could include an immunocompromised mom, grandma, aunt, uncle, father, sibling, you name it. And for the next few days before they start showing symptoms, they would have spread it to a whole lot of other people that they would have been in touch with. Number three, we simply do not have enough resources to test every single student and their family, which would be the better alternative to making sure that we are all 100% free from COVID-19 and that everyone is safe. Number four, it was a good call to close schools, because no way would a government teacher who's overworked, underpaid, frustrated, and only human would manage a class of 70 students crammed into a small classroom, which means that there's no social distancing already. And there's no way that one teacher would be able to make sure that every single child is wearing a mask at all times and sanitizing, when most schools hardly have running tap water, let alone soap for the schools to wash their hands regularly, meaning that the virus could easily spread. I don't want to get into too much detail, but I think that you can see from those reasons, there are more than enough reasons that will help us weigh out which one the possible and the better option would be for the general public. And I would love to hear your thoughts on what the alternative was. The alternative to this whole situation was online learning. For online learning, you would need a laptop, internet connection, and books. Books are fairly accessible, and what is not accessible are the gadgets. We're talking the laptop, the tablet, the smartphone, and the internet connection. Data is super expensive, and Wi-Fi is going for thousands of dollars for only a few gigabytes. What is even more worrying is that Zimbabwe is a developing country, with some children in the rural areas unable to access a simple radio to listen to the lessons broadcasted on a daily, let alone them being able to get a daily meal and having to rely on some indigenous fruits for a meal every day. So how will those children be able to benefit from online learning? They're naturally going to be left lagging behind because they do not have the gadgets for online learning. It's probably at the bottom of their list of needs at the moment. And from speaking to a few parents whose children are in the early years of primary school, they reported that online learning lacks effectiveness. These children, we're talking grade 1, 2, 3, 4, maybe even up to 5 and 6, are already getting distracted so easily, such that when they're staring at the screen and there's so many little boxes of people, they're not even focusing on the teacher anymore, with some of them even exclaiming, "Mama, ndikuda hairstyle iyo," looking at their friend's hairstyle on the camera. So online learning being effective for primary school children, I'm like, really? I really don't think so. But again, I would love to hear your thoughts on this. Those in authority, we can all agree that they're in a precarious position. That is young people, leaders of tomorrow. It will be us in those precarious positions tomorrow. So let us be able to brainstorm ideas and discuss on how we will tackle some of these situations that are happening, on how we can improve the situation and make it better for those around us and for ourselves. So, online learning, resume schools when the pandemic is over, reopen schools now. We would love to hear your thoughts. Get in touch with us through our Instagram page at Light of Hope 64. Also, please go and follow and send us a message on what your thoughts are, and leave a comment in the comment section down below under this video, and a big fat thumbs up. Till next time, stay safe and make sure that you take care of yourselves, because we at Light of Hope, we care about you and your hashtag mental health matters. Till next time, from your host Rufaro, spelled with a PH and an E,